Alrighty, good morning, ladies and gentlemen. We're starting today with the nervous system. Things we're going to learn in the nervous system. Where's my slide? One second. Okay, found it. So the objectives of what things we need to learn. So one way to go with what I'm talking about while I'm doing the slide is to create flashcards. So for example, if you can take a stack of little flashcards or some papers today, cut them in half and just jot down the concepts. Or for example, we're going to talk about the list of functions of the nervous system. You create one slide, it says on it, functions of the nervous system. On the back, you write 1, 2, 3, 4, like bullet points. It's a great way to remember things and to also have a way to organize your mind of how you're going to memorize this information, which is going to help you understand it later. Okay, so first we're going to list the functions of the nervous system. We're going to identify a part of a neuron, which is a nerve cell. There's 3 types of neurons that we're going to talk about. There's also 6 types of neuralgia, which is nerve cells, type of nerve cells. We're going to learn and label the parts of the central nervous system. We describe the function of each part of the nervous system, and then we're going to identify parts of the peripheral nervous system. There is also 5 sensory receptors and learn what their names are and what they detect. And describe proprioception, what that is, and differentiate between the 2 main nervous systems, which is the sympathetic and the parasympathetic. That's in the autonomic nervous system. So we'll have a whole tree branched out for you to understand all the different nervous system sections. Okay, first and foremost, you got the nervous system composed of the brain itself, the spinal cord, and the peripheral nerves, which is the nerves that branch out to all the limbs of the body. Primary function is to collect sensory information. Sensory, meaning things you feel, things you sense. So as the body senses temperature, senses heat, senses surfaces, senses anything, this information gets collected and sent to the brain through the spinal cord, through the peripheral nerves, through the spinal cord, and to the brain. That's kind of how it goes up there. So the primary function, it's going to process the information. It's going to interpret the information to see what the brain is going to do with the information. And then it's going to integrate that information and send out the command of what needs to happen. And everything that happens is collected through sensory, and it gets sent out as a motor response. Okay, so the primary function, again, collection of sensory information that gets processed, interpreted, and integrated into the system. Then there's an initiation of a response or an appropriate response by the motor section of the nervous system. Okay, so sensory in and motor out. Other function, it controls all visible and invisible activities. So things we can't see, right? It controls the internal environment inside our body and also controls the things that we can see, which is our external environment. Also, the brain or the nervous system controls our thoughts and conduct and how we behave. It governs all internal and external movements. So the movements of inner body and outer movement, which is our coordination, our hands and arms and feet and all that kind of stuff. And it gives power to see, to hear, to move, to talk, to feel, to think, and to remember, because all that gets processed by the brain. Yes, you do see through the eyes, through the lens, but it gets interpreted by the brain. We hear music, we hear sounds, we hear vibration, but it gets interpreted by the nervous system, then it translates to our body. Same thing with movement. And as you talk, as you feel, as you think, as you remember, it's all governed by the brain. Okay, so the nervous system is composed of nerve cells. So the functional unit of the nervous system is a nerve cell. Now, in the muscular system, the muscles, which is the muscle cell, is what's the muscular system is made of. It's made of muscle cells, which we talked about that in the previous system. But for now, neurons and nerves is what we talk about here in this section. So, what is a neuron? It's a functional unit. So it has a function. It does things. It has this shape. And this shape is designed to receive information from the dendrites, to get processed and enters the body cell, which is called soma, or the word for body. It enters, so the body cells has the nucleus, just like, our brain has the function of interpreting everything, the nucleus and the body cell. That's where things get interpreted. And then the signal will be traveling down the axon. So that's long tail. So an impulse comes in, a sensory comes in, it gets interpreted, it gets sent out, and it gets communicated to another, which is the terminal, to maybe another cell, another organ, another gland, or another neuron. Okay, maybe a neuron connecting to a neuron. But the idea is the dendrite sense, the body interprets, the impulse runs through the axon and out from the axon terminal. Other things about the cell here, you're going to see this myelin sheath, which surrounds every axon. So it's like a fatty substance that helps the impulse run through better, okay? And the node of Ranvier are these little spaces that you see between the myelin sheaths, which also helps in the conduction of the impulse. Makes things jump faster. The myelin makes things communicate better. All right. Now, types of neurons. There are 3 types of neurons. One is sensory, and another name for it is afferent. Think of letter A pointing with a tip like that going up. So sensory neurons are sensed and directed towards the brain. So going up, okay? A motor neuron, another word for it is efferent. So that's the signal or the impulse that's coming down from the nervous system to the body. Intraneuron, just like the word in between, enter, and then neuron. So it's kind of what happens between the sensory and the motor. There is an intraneuron connection that happens, okay? Which is what happens inside the brain to tell the body what to do and sends it out as a motor response. So a sensory response could be you touching your hot cup of coffee, which was extremely hot. So the body, through a motor sensation, sends to the brain that this is hot. Then the body or the brain at the intraneuron period connects the two, or the reality of what's happening, and then sends the motor response impulse by removing our hands away from the hot surface. So it's the thinking process. Let's think about it, okay? Sensory comes in, we sense it. Intraneurons tells the brain what we're going to do and connects it to the motor neuron, and the motor neuron is what helps us move the body part or move away from danger. Okay, so the 3 types, again, sensory is afferent nerves, motor is efferent nerves, and the intraneurons, another word for it is mixed nerves. So they could be sensory or it could be motor. Okay, so neuralgia, you can make also, so just let's go back here if you want to ever make the flashcards. The flashcards would be, what is the nervous system composed of? 1, 2, 3, brain and the nerve and the spinal cord. the function, collect sensory, process, interprets information, initiate proper motor response, also controls or visible, invisible activity, controls thoughts and conduct, covers internal, external movement, and gives us a power for all the five senses, okay? And memory. Another card you can create that also on our break, or if you want to study after to make sure you have all the information down, type neuron, and the 3 types of neuron is 1, 2, 3, okay? Now we can create another flashcard talking about neuralgia, either way, which is the types of nerve cells in the body. You got astrocytes, oligodendrocytes, Schwann cells, microglia, ependymal cells, and satellite cells. Okay, so we got 3, which is 6 in total, okay? We're gonna dive into them through the book is better because it has description and you just can highlight. The central nervous system responsible for thoughts and emotions, receiving and interpreting sensory information, and this mentally appropriate motor response. So what you think and what you feel is governed by your brain. Any information you receive, the brain interprets it and gives it a proper response. So, and now the CNS, central nervous system, we're gonna refer to it as the CNS throughout, consists again of the brain itself inside the skull, not the skull, what's inside the skull, the 2 hemispheres and everything around it in the back too, and the spinal cords itself. Now, the central nervous system is surrounded by bone, okay? So you got the skull covering the brain, and you got the spinal vertebrae that are stacked up on top of each other, housing the spinal cord in the center. And the brain is surrounded by bone, of course, and covered by meninges, which is the membrane that protects the brain and the spinal cord. So if we dive into the little bit of anatomy here, of general anatomy here, let's talk first about the from the outer to the inner, makes it a little bit more easier. So you got your the skin, right? You see this part is the skin. The skull, which is the bone. You can see all the bone right here. And the spinal cord is right here. And this whole thing is your brain. Now, let's talk about the meninges. So the meninges is the membrane, the protective membrane. And if you can see a little bit here, there's 3 layers, 1, 2, and 3, and then it's housing, so it's underneath the bone, underneath the bone. And the 3 layers are, you can take another flashcards for the layers. It's going to be the dura mater, the arachnoid, which is in the middle, and the pita mater, which is the deepest layer. So the dura is the outmost or the superficial layer, and the pita mater is the deeper layer. The arachnoid is the layer that's in between the outer and the inner layer, which we call meninges. Okay, what else are we going to talk about here before we dive into? So we get the skin, we get the skull, we get the 3 layers of the membrane, and let's talk about the lobes then. The lobes, you got the frontal lobe in the front, and also that's called the frontal bone as well, right? So it's this part of the brain that's in the front. Then you have the parietal lobe, 1 on each side, okay? You have your corpus callosum or callosum, which is the tissue that's between the right and the left hemispheres. and it connects both hemispheres together. Then we have the occipital lobe right in the back of the skull, and underneath it sits the cerebellum right here. It looks like a flower. You got it right here. Now, what else? Part of the spinal cord, we got the medulla oblongata and the pons, okay? And this whole section, which is the medulla and the pons, are considered the midbrain. Again, this is just for you to look at. When we go through the book, we're going to highlight section by section so you can understand what each one of those parts of the brain is responsible for, okay? From here, just understand, I'm not going to highlight this, but it's okay, that we got the skull, which is the hard surface, protective bone of the brain. We got lobes in the brain, the frontal, the parietal, the occipital. Other parts of the brain, we got the cerebellum, helps with balance and all that stuff. We're going to discuss it in a minute. We got the midbrain, which is an extension of the spinal cord that houses the pons and the midbrain. Other important parts of the brain is going to be the pituitary gland, and of course the cerebellum. And that should help us kind of get an idea of the different parts of the brain. Okay, we're talking about the central nervous system. We have the spine, we got the central nervous system consists of the brain and the spinal cord. So this is the spinal cord right here. As you can see, branches of the cervical spine, that means the cervical and the neck from C1 to C7. Then you have nerves that also stemming from the thoracic area, which called thoracic spinal nerves. From each vertebrae, there's one spinal nerve. Then we get to the lumbar nerve. You got 1 to 5. The sacral nerve, you got 1, 2, 4, 1, 2, 3, 4, 5, because there's 5 infused vertebrae. And then the coccyx, there's 1 nerve that comes down from the coccyx, which is the little tailbone at the end, okay? So the sacrum and this little tip in the tailbone is going to be that one. So we got 7 coming out. There is actually 8 nerves or 7. I'm going to double check and see. And then you got your thoracic 12. You got your lumbar 5. And then sacrum 5 and 1 at the end terminal here. So that consists of 31 segments. So it houses in the vertebral column. So the vertebral column is here inside the vertebrae. There's a column, and that's what houses the spinal cord. And extends down from the oblongata medulla, which is right here from the oblongata medulla. And all these nerves are pairs. So there's left side and right side. And they constitute 31 segments, 31 areas, okay? Okay. Next, we have the peripheral nervous system. So this is the system that branches out from the spinal cord out, okay? So we have nerves that stem, which is these are the cranial nerves that you see here, and we're going to have each one of them has a job, or each one of them connects to a different aspect, whether the eyes, the ears, the face itself, the internal organs. So we have all these nerves, the olfactory, the optic nerve, trigeminal nerve, facial nerve, hypoglossal nerve, accessory nerve, glossopharyngeal nerve, abducent nerve, trochlear, oculomotor nerve, and we have the, where's the vagus? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well, there's supposed to be also 2 more. The vagus nerve is one of them too. So we'll get to that in a moment, but understand that these cranial nerves that stem out from the cervical spine connect to the skull or to whatever is housing the skull, which is the eyes, the ears, the nose, the mouth, the face, all that stuff. So the spinal nerves, it's important to understand how many there are. So there's 8 pairs of the cervical nerves. So that's why I tell you some books, they say we have we have 7 cervicals, and some books says we have 8 cervicals. So in the test, it's 7. But there is 8 pairs of cervical nerves, 8 from each side from the cervical. So maybe the 7 and 8 come out from the 7. But don't worry too much about that. That's just a technicality. All you need to understand is all these 31 nerves, where they come from. So you got 8 from the cervical nerves that they connect to your face or to the cranium. You got 12 pairs of thoracic nerves, 1 for each vertebrae of the thoracic spine. Thoracic spine has 12 nerves, and 12 vertebrae, and each one of these vertebrae is connected to a rib and gives us the 12 ribs. Yeah, so 12 ribs, 12 nerves. When it comes to the lower back area, which we call the lumbar area, there is 5 vertebrae there, and it has 5 pairs of lumbar nerves. So 5 on the left, 5 on the right. And when it comes to the sacral nerves, even though it's an infused bone, the sacrum, but there is, you're going to see 5 foramens or 5 round bony landmarks or holes that the nerves come out from, and they connect to the legs. And 1 pair of coccygeal nerve at the coccyx comes at the tip of the tailbone. So if we come and now talk about the peripheral nervous system, so now this is the second half of the nervous system that we're going to talk about. And then from there, we're going to stem into another branch of the nervous system. So right now we have the central nervous system, which is the brain and the spinal cord. Now we have the peripheral nervous system, which is the nerves that you see right here in the graph, connecting to everything from the neck below. Okay, so we got the brain, spinal cord, this is central. Now everything else we're gonna see here is the peripheral. So the peripheral has cervical plexus, so cervical nerves. We have brachial plexus, which run down the arm. You have the ulnar nerve stemming from the brachial nerve. Now, when it comes to the lumbar, we have lumbar plexus. When it comes to the sacral, we have sacral plexus, meaning the cluster of nerves are coming from the sacrum, the cluster of nerves are coming from the lumbar, so far and so forth. You're all familiar with the sciatic nerve, right? That's the thickest, the largest nerve in the body. It's as thick as a 1/4 inch, I believe. Could be as thick as this finger or maybe your ring finger. It depends on your hand size. But it's a 1/4 inch, so that's pretty thick, pretty large nerve. Then you have your tibial nerve, peroneal nerve, and the saphenous nerve. As you can now look and remember the cardiovascular system, the name of the nerves are similar to those names. And it comes to and that's what makes it easy about the body is you get to realize that the bones and the tissue and the blood supply all kind of take on the same name. So it's going to sound like it's a lot of information, but as you go through the systems, you're going to see a lot of repetition and you see a lot of connection. All righty. Now we got the plantar nerve because the plantar foot is close to the foot. We got the femoral nerve close to the femur. Radial nerve, median nerve, the autonomic chain of the ganglia, which we'll talk about in a moment. Intercostal nerves, which are the nerves that connect to the ribs, as you can see. So the 12 peripheral nerves of the ribs connect to the ribs. And we have 31 pairs of spinal nerves carrying from the neck down, okay? Or shoulders down, or as you see it, from thoracic spine down, okay? All right, now, two things about the peripheral nervous system that is used a lot in muscle testing and figuring out if there's a damage to a nerve or not through the dermatomes and the myotones. I don't know if they're not here, but we'll see. So most important is dermatome. So it's a skin segment innervated by the spinal nerve. So C4, T3, T5, all these numbers right here, it refers to the nerve that's stemming out from the peripheral nervous system. So, for example, T2 coming from the thoracic vertebrae 2, that nerve innervates this area. So if there is a damage to this nerve, you will not be able to feel sensation on this area, and vice versa. C5, for example, coming from the cervical spine number 5, is going to innervate that lateral aspect here of this arm. You see a lot of people might come to you actually complaining from numbness in their fingers. Okay, and that could be a compression of the brachial nerves in the neck. So you can see C6 to the thumb, to the radial nerve, C7 is going to be the middle 3 fingers, and C8 is going to be the ulnar side, C8. So this is the idea of the dermatome. It's like each nerve that stems out, it innervates the surface of the skin and sensation for each section. Myotones, if they are in this book, I'll explain them, but here, just briefly, a myotone is the same, but it innervates a muscle. Instead, a feeling in the nerve innervates the function of the muscle. So if there's a damage to the nerve, then the leg won't move properly or won't move at all. You see those doctors that do this orthopedic or whichever doctors, they kind of get that little hammer and they kind of see reflexes of the body or the joints to see if there is a response from that nerve or not, if the nerve is damaged or not. If you stimulate it and it responds, then it's good. But if it's not responding, there's a damage or a compression happening in the nerve.
I have a question, Ms. Summers. Are you going to be reviewing at 3 o'clock?
Yes, maybe even sooner. Are you going to stay for the session right now?
Yeah, I'm here. I'm going to have a client like in 20 minutes, but I'm here listening.
Okay. Just always message me because this is always recording on YouTube. Okay. If you have a question, message me and it's easier for me to respond to you.
Thank you.
You got it. Okay. Now the peripheral nervous system is a system that senses things. So that sends sensory to the central nervous system. Okay. And these sensory receptors or sensory organs or the things that help us feel are into these 5 categories. Mechanoreceptors, so mechanical, could be like pressure or something that we add to the body, weight, stretch, something like that. Thermoreceptors, from the word thermo, which is temperature, so it senses temperature, and translate that to the brain because there's a receptor that's specialized to sense the heat, the temperature. We have photoreceptors for light, chemoreceptors, anything chemical, could be an additive of salt or something like that. And nociceptors is pain receptors, and they're all over the body. So the sensory receptors are 5, so you should make a flashcard on those. The chemoreceptors, thermoreceptors, photoreceptors, chemoreceptors, and nociceptors. Okay. Now, next, we have the extroreceptors and proprioceptors. Now, the extroreceptors, they record conscious sensations, things you feel consciously, where the proprioceptors is a response to unconscious kinesthesia. In other words, it's your perception to your surroundings, is movement of your limbs or of your body to that surrounding. So it's more an outward environment, where the extroreceptors is more internal receptors of internal environment. But this is the one that we need to focus on, is our perception of our body to the external environment or in space. One moment, please. Make sure I got everything here. Okay. Let's continue. Now, we talked about the sensory receptors. Let's go back a little bit. These are the sensory receptors. There are 5. And now we have the other receptors, which has to do with proprioception, are 3. There are muscle spindle cells, which are embedded inside the fascicles of the muscle. So it's in the middle, in the belly of the muscles. You have the Golgi tendon organ. So these are receptors that are at the attachments or the ends of the muscle. And then you have joint receptors. So joint receptors, they're going to feel motion or change in the joint position. The Golgi tendon, they're going to feel the stretch at the end of the muscles. So when we extend our arm, our tendons and muscle are lengthening. So let's say you were walking down a slippery area, and then you didn't notice the water and you slipped. So what happens at this moment? You had an uncontrolled slip, right? So uncontrolled muscle contraction or unpredictable. So what happens, usually our body will guard and it will tighten. And that is the mechanism that's happening from the Golgi tendon. They're sensing a sudden change of length. And as a protective mechanism, the Golgi tendon organs are gonna contract the muscle to protect it from tearing or overstretching. Same thing is here with the muscle spindles, but the location is different. They're located more in the belly of the muscle, and it's gonna also feel the pressure or change of length in the muscle. And that's how we feel through these organs. So proprioception has to do, again, with the external environment where our body is located, where we're located. Okay. So far, so good? All right, let's see how many we got. We got the autonomic nervous system. Okay, so we have the nervous system as a whole. We got the central, which is the, again, brain and the spinal cord, and we have the peripheral, which is all these nerves that stem from the spinal cord to the rest of our body. And these nerves, their job is to sense, okay, our surrounding and to send it to the nervous system to get processed. And with a response is going to be motor, right? Or either or. But the idea is that's what the central nervous system, that's what the peripheral is there for. Now, there is Now, part of the peripheral nervous system is the autonomic nervous system. So the autonomic nervous system is part of the nervous system that we don't control. That's why it's called autonomic. It's automatic. Okay, for example, regulation of glands, smooth muscle, and the heart. So the glands, I cannot tell them not to secrete anymore. Okay, and I cannot tell my heart not to pump. So these things are there no matter what. You have no control over them. Now, they consist of motor neurons that originate in the central nervous system. So this autonomic nervous system tend to be motor in nature, means sends out activities to be done, okay, throughout the body. And those actions will balance the body between the sympathetic state and the parasympathetic states, which I'm gonna explain both. Okay, so the division of sympathetic and parasympathetic, it's part of the autonomic nervous system. Tomorrow, when we come to class, the first 15 minutes, 20 minutes, even 30 minutes, we're gonna refresh those concepts and make sure you have your flashcards, and I'll repeat them again. So let's dive into more. What is the sympathetic nervous system mean? And what does the parasympathetic nervous system mean? So nerves of the sympathetic nervous system control secretions or are connected to, our eyes, our glands, our heart, our lungs, our internal organs like the pancreas, the spleen, the liver. So that means all these things are gonna turn on or turn off when they are in the parasympathetic state. It also has connection to our digestive tract and to our excretory system, which is the kidneys, the urinary tract, and our bladder, okay? So what does that mean? That means if you're in a sympathetic state, which is fight or flight, or when there is stress. So sympathetic state is stress. It doesn't mean always is bad stress. It's just stress. It depends on also the scenario. But when there is stress on the body, there's going to be certain aspect of the body will increase. For example, heart rate will increase when we're in this state. Our cardiovascular ability increases because the body needs to respond to the threat, whether it's mental, physical. Body doesn't know any better, physical or mental. It's going to respond the same way. When there's stress, it needs to deal with it. And since the digestive tract and urinary tract, it's not a priority when there is stress, they're going to slow down in function. Where the heart and the lungs, they're going to increase in function because we want to run away, right? We don't want to, we're not there set to stay. When there's sympathetic nervous system activation or fear or stress, we want to run away from the situation usually. So the body prepares itself to do so, and it shuts off the rest of the organs. Now, the problem is if we're always in this state of stress and sympathetic nervous system state, then we start to burden the body and we start to overwork certain aspects of our body and underwork others. So the body will get out of balance just from this fact. And let's just go back one nerve. So just to help you understand, these nerves of the parasympathetic nervous system, they stem out from the thoracic and lumbar area. I'm not sure if it gets to the lumbar, but definitely from the thoracic area, L1, L2 only of the lumbar. Okay, so what houses the lungs and the heart is those nerves, okay? When we go to the parasympathetic, which is the state of relaxation, or relax and digest, another word for it, we're going to see the opposite happening. So these nerves are connected from the back of your skull, okay, where the midbrain. So our brain was developed first from the midbrain out. The last thing that got developed in our brain, our evolution, is our frontal cortex, which is our frontal brain. And you have the S2, S3, S4. So the sacrum, okay? So the sacrum area and the behind the occipital area, or the mid, let's call it the midbrain medulla area, is where these parasympathetic nerves are stemmed from. So as we initiate our massage, sometimes we recommend, you ground and you connect to the parasympathetic nervous system of the client, not the sympathetic. What we want to do is we want to get them out of the sympathetic nervous system state. We want to bring their heart rate down. We want to get them to relax and breathe and activate the parasympathetic nervous system, meaning placing a hand on the sacrum and a hand on the back of the head. And that will initiate relaxation right away. All right, and you can see we can see the connection also of these nerves to the internal organs, excretory system, and we got also the nerves that connect to our breathing, stemming out from the cranium, to our heart, to our liver, to our lungs, spleen, and all that stuff. So all the internal organs. And again, parasympathetic nervous system, it's meant to relax, slow breathing, more time digesting the food, more housekeeping done by the body, things, So when you have a day off or extra days off, what do? You try, or what you would like to do is clean up your space, get rid of stuff, do these kind of housekeeping things. And that happens at the parasympathetic nervous system. And if you spend too many days or too many time working and stressing and doing all these things, the work of the parasympathetic nervous system gets worked up. So you put your body in a lot of debt for relaxation and breathing and rejuvenation. And again, the homeostasis that needs to happen here is between the sympathetic and the parasympathetic to bring the body into this balanced state where it does not require a lot of energy to sustain it, and it doesn't take a lot of wear and tear on the body, whether it's physical, mental, or neurological, okay? Okay, so the autonomic nervous system, we're going to explain what happens when the nerve goes through to the nervous system and back. Okay. So this is the neurologic pathway, or neural pathways, is the route that the nerve impulse travels, okay, from through the nervous system. So here, we got a leg, we got a muscle, right? Remember I told you this kind of, you go to the doctor to get that hammer and they kind of give you that little hammer on below the knee to see if your knee would reflex or would act. Think of the same. This is the scenario. There is a nerve right here connected to this muscle. It's a motor nerve, okay? And ending or effector, just call it motor nerve or efferent nerve, okay? So that nerve is connected to the muscle. Now, we got sensory nerve that's connected to this area of the knee or the skin. So the sensory or the action is happening here. The signal is traveling to the brain through the axon of the nerve cell. So it's a sensory neuron, yes? And it travels to the cell body, then it travels to the dorsal root, which is this area right here. And this is a spinal cord. I forgot to explain that to you. This is the spinal cord itself, okay? It has gray matter and has white matter. Okay, so the spinal cord has gray matter and white matter. So as the sensation comes in, it gets traveled through the axon as a sensory neuron enters the body cell, and it sends it to the dorsal root of the spinal cord. A synapse is when an end or a terminal of one nerve, okay, comes in contact with another nerve. And that's what we call it, the connective associated nerve or the intraneuron. Remember the three types of neurons that we have? One is motor, or one is sensory, okay, which is afferent going up. One is motor coming down, and one is intraneuron, which is connection or communication that's happening, like your third person between the sensory and the motor. So as the nerve or the impulse travels up the axon, enters to the dorsal root, connects to the intraneuron, this is where the brain or spinal cord figures out what to do and sends that command, okay, to the other synapse right here, which connects this intraneuron to the motor neuron, travels out from the ventral root down to the motor neuron towards the leg as a motor impulse and tells you to kick off the knee or contract that muscle. So what do you need to learn from this simple, looks simple, but it's quite simple. It's just new names, is that there is a signal that comes through and it comes out. Comes through as sensory, comes out as motor. It goes through the spinal cord, through the dorsal root, and it exits through the ventral root. And the intraneurons usually are a mix of motor and sensory, and it connects neuron to neuron. Now, the autonomic nervous system, area most sensitive to reflex influences. So back between the shoulders, this area is most sensitive to the reflexes. Side of the chest between the fourth and the fifth rib, so lateral area. Upper and inner portion of the thigh. And we can discuss those tomorrow in practical. And skin overlaying the gluteal muscles and the sole of the feet. So these areas are sensitive to touch, in other words, okay? So again, it's back between the shoulders and side of the chest. So lateral, so this is posterior, side of the chest, lateral, upper, and inner thigh, that's medial. The portion of the body, this is posterior, the gluteal area, the whole glutes, and plantar, which is the sole of the foot. All right, so today we're not going to talk about the neurological disorders of the nervous system. We're going to leave those for Wednesday. Okay, we're going to leave all those for Wednesday and give you time to read up on them. But I guess I can go a little bit briefly on them. This way I can mention them at least. Okay, so multiple sclerosis, it affects the body's ability to control the muscle. And it progresses. So as it progresses, the disease, it gets worse. Okay, so it's a degenerative nerve disease that affects the body to control muscles. Population affected between the ages of 20 and 50, young adults. Okay, what causes MS is the breakdown of the myelin sheath. So the myelin sheath, if I would go up all the way here to show you what the myelin sheath. Okay, so these the sheaths. See these sheaths that help us conduct nerve impulse? They start to break down. Okay, so it inhibits the nerve conduction. And symptoms can vary between, depending on the area of the brain and spinal cord that it's affected. And so what can they suffer from? They can suffer from muscle weakness, loss of coordination, loss of balance, loss of bladder control, speaking becomes difficult, vision also gets affected. They can also experience memory loss or difficulty concentration. So that's because of the myelin sheath, which are made of fatty substance. Okay, so what else about this? So there's periods of where the disease is exacerbates, means it flares up, and there's periods where it's in remission, where the person is not suffering as much. So they may have episodes. But the disease is progressive and it just gets worse with time. You can manage it, that's the best we can do. Okay, now Parkinson's disease, that's the second one, results of loss of ability to produce dopamine. So dopamine, what makes us, alert, energetic, some people are addicted to dopamine, so they put themselves in a stressful, risky, situation, so they get their dopamine up. Addiction actually gets your dopamine up when you get what you want. So these are kind of a thing. Our phone gives us dopamine. So when we lack dopamine, it's not a happy person. Okay. Also, it causes lack of coordination and difficulty moving. What else? All right, so we talked about dopamine. So what you can do, symptoms of dopamine could be tremors, shaking, especially in the hands. There's muscle stiffness, movement slows down, become more deliberate. A lot of the postural reflexes gets lost, so they're going to see a lot of problems with the posture. Now, the progression is like also MS. It's gradual and it progresses, but now you get rigid muscles, especially the flexors of the hand. And the gait becomes, meaning your walk becomes very stiff. Now, massage is useful to maintain flexibility, relaxation. Same thing with MS. Massage can help release the feeling of anxiety, the feeling of depression. But definitely, if you have those kind of people coming to your practice, they're definitely working with a doctor. So you must collaborate with the doctor for the best course of treatment or type of massage to deliver to the person. Okay, now we have amyotrophic lateral sclerosis, ALS. You probably know it by ALS. Also known as Glau Gehrig's disease. Causes motor neurons to degenerate and die. So again, we said 3 types of neurons: the ones that sense, ones that interpret, and ones that connect. Okay, and one that sends out the action, which is the motor. Okay, in this case, the action gets is the problem. So they cannot generate the action they need, and it affects people from 40 to 60. It affects twice as many men as women. Early symptoms of it could be weakness, twitching of the legs, the arms, the hands, learning speech. It depends on the nerves that are affected, okay? Later symptoms of this disease progress. So it's going to affect, of course, the motor. So it's going to affect the muscles throughout the body and the ability, again, to speak, to move, to swallow, and eventually breathe too. So there's no cure for ALS, unfortunately. 50% of the diagnosed people die within 3 to 5 years, and 90% within 10 years. So the cause of death for them because of the paralysis of what? Of the ability to breathe. It's pretty sad. Okay, now you get spinal cord injuries caused by trauma, accident, disease, infection of some sort, affects the ability to transmit nerve impulses. So in this case, the column results like there's going to be pinching of the nerves, bruising, or tearing of the spinal cord. So that's pretty traumatic and severe injury. So it will affect also the fibers, the nerve fibers in the cord to transmit impulses to and from the brain. Symptoms of spinal cord injury can differ. It depends on the injury, but it's going to be it's going to affect sensation and movement, which is sensory and motor. Now, if you have a serious injury to the spinal cord, it depends on where in the spinal cord. So, for example, you've heard of a quadriplegic. So that means quads, arms and hands can't be used. So from C1 to T1, anything from C1 to T1 will result in tetraplegic or quadriplegics in the name for it, and affects the neck through the shoulders, the arms, and the legs. So everything from the neck up, it would be okay. You can hear, you can see, you can smell, you can speak. The paraplegic is injury between T2, the second type, and S5, so all the way to sacrum 5, any place in there. So it's only going to affect the middle of the body, from the chest, stomach, legs, and feet. So it depends where the injury, what the effect will happen to the body. Now, massage can be beneficial for these people with the spinal cord injury, but it requires some special consideration. So again, they're probably working with their doctors, so it's never too bad to check in with the doctor and see what's the best course of action. Because as you know, they cannot feel your touch, but they can benefit. So pressure, you're not going to be able to gauge the pressure if your pressure is good enough or not good enough because they can't feel. But you'll be able to help the tissue underneath and the joints and all this. Okay, stroke, CVA, cerebrovascular accident, CVA. So this nerve tissue destroyed by ruptured blood vessels. So it's going to affect blood flow. And it depends on the location and the extent of the damage. So stroke is the third leading cause of death in the US. I believe probably other places too. Of course, you got cancer, you got heart disease, so you got these three major ones. So the symptom may have loss of vision in one or both eyes, loss of speaking abilities, or even understanding language, loss of memory, and personality change as well. Sometimes there's paralysis that comes with the stroke, so often caused on one side of the body. It's the opposite side of the brain in which damage occurred. So if it's damage in the right, you get the left. If you have damage in the right brain, you have the left side of the body that's going to get paralyzed. And the extent of the paralysis relates to the extent of the neurologic damage that happens. Now, massage can be beneficial, part of the stroke rehabilitation program. Of course, they're going to go through one. But you're going to work with the doctor. Again, it's beneficial, but you want to work with the doctor to see what's best for them. So another consideration would be paralysis. So deep massage toward these muscles would be contraindication, meaning we do not do deep massage, okay? Because the lack of sensory is low or diminished because of the paralysis. You just be careful. Okay, epilepsy is abnormal electrical activity in the central nervous system. and it characterized by an actual seizure, which are mild, but they are noticeable. Now, people that live with epilepsy can live normal life, produce lives like any other person, but they require some medication to what do you call it? To control the seizures. Massage, on the other hand, is inappropriate during a seizure, of course, because you won't be able to do that. So what we'll do is you're going to massage them when they are normal, in a normal state. If you have somebody that has epilepsy that comes to you, make sure you check in with them, see if what's the procedure if they have an epilepsy, who to call, and what to do, okay? Because they're going to be responsible and they're going to let you know if something like that happens and what to do. Okay, another neurological disorders that can happen is from viral or bacterial infection like polio, encephalitis, and meningitis. Again, encephalitis, meningitis, they're both inflammation. And what can cause the inflammation can vary, depends on the contamination or the wound or the bite or where you got the contaminants from. So polio, for example, is a crippling and deadly disease that affects the motor neurons, right? The ones that help us sense commands for movement, which stem from the medulla oblongata and the spinal cord and result in paralysis of the related muscle tissue. Symptoms of polio can be fever, gastrointestinal discomfort, stiff neck, and headaches. Alrighty, massage. Massage depends on both. If somebody have polio or post-polio syndrome, so again, you just talk to your doctor and see what's the best direction of action, okay? Encephalitis refers to the related viral disease that causes the inflammation of the brain or the meninges. So the meninges is the covering of the brain, the protective covering of the brain and the spinal cord. So a virus can come in and can affect that, and the response of the body will be with inflammation. So inflammation of the brain is encephalitis, and infection of the membrane or the covering protective brain of the meninges is meningitis. Okay? So encephalitis sometimes spreads from maybe an animal or a bird or mosquito bite or secondary infections that happen like chickenpox or something. So headaches, fever, disorientation, it's quite debilitating, okay? Sometimes seizures for some people. The cause may result in a nerve or brain damage or may cause paralysis, emotional disturbances, and in some serious cases, death. Massage is systemically contraindicating, meaning if the person is in the infection period where it's acute, we do not massage, okay? Only when they have subsided from those symptoms or the inflammation has went down, then we can do massage. Okay, now meninges is the actual inflammation of the deeper layer and the mid layer of the membrane. We said there's 3 layers, right? The dura mater, pita mater, and the arachnoid, which is in the middle. So this is going to be the middle and closer to the brain infection. And all happens to bacteria or virus. Or secondary infection, maybe coming from the ears, maybe from the upper lungs, sinuses. You know, everybody, you never know. The symptoms of it, again, it's severe headache, stiff neck, high fever. So it's like your fever times 100. And often delirium, some convulsions, and in severe cases, they can head to can affect and get somebody into a coma. Treatments, they usually give them antibiotics, something that's usually effective to kill the virus, bacteria, but everything has to take its course, okay? Okay, I know this is a longer session right here, but stay with me because we're recording it, and then after we're gonna do questions. and dive more into, good, okay, thank you. And we're gonna dive more into like doing the workbook and all that stuff. Okay, now the viral or bacterial infections we talked about, and now we have neurological disorders like the shingles. So it's also an inflammation. So it's an acute nerve inflammation caused by the herpes zoster virus. It's the family of herpes, but this one is different. Okay, this is just like a chicken pox. It's not like chicken pox, but an acute inflammation. That means it's gonna have remission at some point, but it's like a band of pain around the torso. It comes with rashes, blisters. It's terrible. It feels very hot too. All inflammation will feel hot in your body. Now, what causes shingles is exposure to the chickenpox virus and the herpes. Yeah, something like that. Now, the massage is a consideration. Now, of course, if it's in an inflammatory state, we do not massage because it's painful and it will make the inflammation worse. Now, you could do local massage. Maybe you could do some certain areas that hurt the body, the person. But as where you feel the shingles and the chickenpox, we do not massage. They need to go see a doctor. Okay, neuritis or inflammation of the nerve, it's a symptom and it's not a disease. So it's symptoms like, fever is a symptom, hot flash is a symptom, something like that, okay? So neuritis is a symptom or other conditions such like da. Okay, nothing important about that besides. They just affect the peripheral nerves and they kind of cause weakness. There's nothing you can do. Treatments, you go to the doctor and the doctor will give you some things to subside the pain, maybe some vitamins you're missing. Yeah. So you wait for the symptoms to subside and then you can do the massage. Okay, other more important, what do you call it? Diseases that will come across are, since we talked about the nerves, remember we talked about the brachial nerves that stem to the arm. They might get some compression. So the TOS, which is thoracic outlet syndrome. So you might be able to help more people with those kind of things. It's caused by a compression and entrapment of the brachial plexus and or blood vessels from the arm. So in the cardiovascular system, we saw the map of the veins and the arteries, and they had same names that we just talked about now with the nerves. So we got some nerves that are going to stem out from your spine, run down your arm to your fingertips. And some of those nerves, they run underneath muscles. And sometimes the compression happens from over tight muscles or deviation in the posture of some sort, or an injury, using the shoulder in a not proper way. So it causes compression and it causes entrapment of the brachial nerves. Okay, so it originates in the spinal nerves, to be exact, C5 to T1. So the brachial nerves come from C5 to T1 and they travel to the spinal foramen. So spinal foramen are the holes that the nerve come out of, okay? To be more exact, those muscles are going to be your scalene muscles. So we have 3 scalenes, right? We have anterior, medial, and posterior. So between the anterior and the medial, you got the nerves running under, and that compression of the scalenes could create the compression, which is between the clavicle and the first rib, all that area. Now, nearby vessels here, we talked about the axillary artery, which is closer to the axillary region, and the subclavian vein, right? We talked about those, may cause also this entrapment. So what we could do here is we're going to alleviate, well, it depends on the situation, okay? It depends on the muscle involved. Usually just a little alleviation of those muscles can help the compression, but sometimes in some cases there might be some bone spurs, there might be a herniated disc, some pressure from some rib. So that could be a little bit more of other reasons that they might need a doctor's clearance or doctor help. But a lot of the cases, there might be just entrapment because of muscle compression. Now, we got compression here that's happening on the brachial. We also have compression that happens on the wrist. And I'm sure you've heard this carpal tunnel syndrome caused by compression of the medial nerve, right? Come to the middle of the fingers. So it runs underneath or right where the carpals are. And some compression can happen there, causing by repetitive. Sometimes people that are on the computer, they can develop that. Many hours of the same. You could be a butcher, kind of cutting, could be a cashier, you could be somebody that does the same thing over and over. So what you're doing a lot of stress also on the connective tissue, on the tendons, and not just the muscles, also the connective tissue. And you can create also fibrosis there, which is kind of a hardening of some tissue, and that can entrap those nerves. Or you could irritate the nerve itself. So massage is important. It can help, especially if you're familiar with the job that they do. But if you're not able to help them by releasing the compression or the compressed nerves, or by working this fibrosis out of the way, or working those tissue, then you can go and refer them to a doctor. But a lot of the time, increasing range of motion, working through the tendons and the muscle fibers, tractioning can help a lot with the carpal tunnel. And my friends, that would conclude it for our brief slides right here. Let's take a break and we're going to resume after. Let me stop the recording and then we'll continue. 1 second.